and welcome back to Your Autism Game Plan. I'm Joya Vanderlaan, a family nurse practitioner, a functional medicine specialist, and an autism mom. In my practice in Illinois, where I see patients, I see SIBO and SIFO sometimes. I wanted to do this video because I'm getting a lot of questions from Your Autism Game Plan audience about testing. And so last week we released a video on testing for SIBO, and this week I wanted to talk a little bit more specifically about treatment for SIBO. One of the reasons for that is that it's very confusing. You can Google treatment for SIBO and find all sorts of different things. A lot of it's outdated. The thinking on treating SIBO has changed from antibiotics and a low FODMAP diet to kind of what I'll tell you more about, but you're still going to find all that antibiotic and low FODMAP diet information out there. The reason why I do not like the give them antibiotics and put them on a low FODMAPs diet approach is it does not address the root cause. Two huge root causes of SIBO, SIFO that I'm seeing are H. pylori and impaired intestinal mobility, and specifically impairment of the migrating motor complex, or the MMC, which really kind of controls the peristalsis, or controls those muscle movements of the intestines pushing food along in the system. If that's not working, food gets stagnant and sometimes can even reverse flow, causing the growth of bacteria in places where it shouldn't be overgrowing. So we need to address those two things. So that's one reason why stool testing is helpful. It identifies an H. pylori infection. One of the reasons H. pylori can be a root cause of SIBO or SIFO is because H. pylori by nature reduces the acidity of the stomach. Why do we have acid in our stomach? Well, for a few different reasons, but one of them is to kill pathogens that come in through our digestive system, through our mouth, through our food, and kill those before they can enter the small intestine. Well, if H. pylori is present, stomach acid is decreased, then we don't have enough and potent enough acid to kill those pathogens before they can establish themselves and overgrow in the small intestines. They get past the stomach. Now, with the motility issue, again, if a child is constipated, that would be a huge reason why motility would be impaired. So we have to address these underlying causes. I have put together a protocol in Fullscript specifically for SIBO. I've got all the autism supplements that I've talked about kind of in one protocol for you in one link. And I can link that below for you too if you're interested. It's become a rather long list because as I kind of talk about a different supplement, I will put it in there so you can easily find it. With the SIBO kind of protocol that I use, I will actually put people on this, kids, adults, on this, sometimes before we even test. If it's obvious enough that there is a very high suspicion of SIBO or SIFO, I often will start the protocol first, because even if it's not SIBO or SIFO, this protocol is so healing and so useful, and I use to treat so many different disorders and imbalances and infections in the gut that it almost doesn't matter exactly what's going on. We don't need to know exactly what's going on. It will help with that. And then if we want to test later, we can always test later and see what the remaining problems are. But at least we've kind of taken a few steps in the right direction with this protocol. Things included in the protocol are a spore-based probiotic. These are really, really hardy probiotics that actually help to repopulate the gut. Normal probiotics, lactobacillus, bifidobacterium, they do help with certain things. They have effect on the immune system and all sorts of things, but they don't generally help to repopulate the gut because they generally aren't getting past the stomach. So that's where spore-based probiotics come in. Spore-based probiotics are kind of covered in a capsule, a really hardy capsule, and the probiotic part of it is sort of not released until later in the digestive system, making them able to repopulate the gut. So the spore-based probiotic is one. The next part of my protocol for SIBO is a prebiotic, and the prebiotics help to feed the good bacteria. And this particular prebiotic formulation specifically does not feed bacteria that are usually implicated in SIBO or SIFO. So it doesn't usually worsen the SIBO or SIFO. The next product I always use is Mega Mucosa. It heals the mucous membrane, so that inner, one cell layer. It heals the inner lining of the intestines, and that's hugely helpful, even for things like eczema or asthma and all these sorts of things. Gut health is very often implicated. So the Mega Mucosa is really, really good. Mega IgG is another one. So it contains a lot of these really nice immune globulins that kind of help to soak or eat up the bad pathogens and get them out. So they kind of help our immune system to overcome the overgrowth in our intestines. And the last thing that I very often use is a promotility agent. In other words, an herbal formula that helps to keep that migrating motor complex moving. So keep those intestines moving and the peristalsis moving so that we don't have backup problems or constipation problems. Usually what is in these types of formulas is a mixture of ginger and artichoke, which have been shown to help with motility. So I've put those products in a SIBO specific protocol for you. There's some inulin in there and some fish oils too, which also are very important kind of for general health, but specifically for SIBO as well. So you can have a look over that and see, maybe that's something you want to try with your child before paying, hundreds of dollars for testing or kind of going down that route. The whole purpose of your autism game plan is to kind of give you a leg up, to give you reliable information from both a healthcare provider and from a parent who knows what it's like to go through this, information you can trust, so you're not spending hours Googling or hundreds and thousands of dollars and months waiting to see specialists for this. I'm trying to provide you with actionable information that you can use right away at home. So please feel free to comment. Let me know if there's anything else you'd like to learn about and hear kind of a professional and parent viewpoint on. I'm always happy to take suggestions for different topics that are pertinent for you, that you want to learn more about, challenges that you're having, anything like that. So thanks again for watching, and remember, be gentle with yourself. You're doing a great job.